Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everyone. This is Doug Nelson, the president of the Massage Therapy Foundation, and I'm on with Dr. Geraldine Cameron and Dr. Virginia Cowan. And this is a bit of a continuation of a conversation that we started with another Research Perch. But in that segment about cancer care, we were talking about translational research and how important that is. And that led to many different aspects of the discussion. And one of the things is just the value of what translational research is and why maybe even more important for the massage therapy profession, translational research is so important. So first, so I'm going to go first names now. Virginia, can you talk about what translational research is?
Happy to, and I'm absolutely delighted to get the chance to talk with you both about this. So it's taking research findings and ideas that emerge from research and bridging those into patient care, into client care, and into practice. So there's no single definition of translational research, but all research is done through stages. And so if you think about discovery type research, that's something that the NCCIH is talking a lot about, which is what are the mechanisms that explain massage and how it works. And that's on the early end of translating research. And so there's a lot of research on animal models. There are little rats in labs getting their hamstrings, massaged for the benefit of research. And that's great for them. But if you think about then taking it into practice and saying, all right, if it works on rat hamstrings, how is this going to work on humans?
Yes.
Translational research tends to draw upon pharmaceutical research models, and we don't really have to go back that far. We don't have to go back to rats every time we want to massage a person, but we really want to then look at research evidence for, in particular, the first question, does massage work or not? And then you're going to be drawing on placebo-controlled or no treatment-controlled studies. But then we get to a point where we say, does this work differently than that? And that's really where translational research in massage starts to emerge. And it gets us closer to the bedside in the bench to bedside description, or closer to the table, to then look at if there's research evidence that massage for an hour 3 times a week is more effective in the short term, then that's something that we could implement in our practice and measure those effects on our clients.
Absolutely. It would seem to me that is eminently practical for the therapist to explore those kinds of ideas as well. Awesome.
I really like the idea of practice-based research. I mean, even though I've been a clinical trialist where we do research, at an institution and, people come to the clinic and they get exactly this type of massage or care. That's not what people do in practice, generally speaking. I mean, we try and mimic what happens in practice, but practice is practice. And so getting that information gathered in the practice in order to assess it, to see what types of variables are there, what differences are there between different types of patients, it's just essential. And it really is the next step that has to happen.
So, and that's a really nice entree. So I'm laughing because I initiated a project, I guess it's now going back 4 years. I had the distinction of presenting at one of the AFMTE meetings, and I had 5 people attend my session. 5, but it was on secondary data analysis. So it was how actually this can be done. And in particular, I was interested in massage school clinics. So I did an analysis and presented a poster at AMTA on that. And so this is on the foundation website. I think the poster is available, but it was looking for common themes and how clinics are collecting data and then how those data can be mined. And this is happening throughout healthcare. And so it's really, patients are getting treatment. So if you think about a kid with asthma who presents in the emergency room, the key for the kid is to have them not come back to the emergency room. So then you can look at what precipitated that. You can dig into their health records and analyze that to try to look for different factors. And we don't tend to talk about research like this. Research is always, the randomized controlled trial is the gold standard, and that's really what we've been drawing on for years. But we have mountains of data that we're collecting on massage, and gathering that and aggregating it and analyzing it, sadly, is expensive to do because it requires software, but we have a lot of power to be able to do that, whether it's text or numbers.
And when most people think about research, I would think they think about the randomized control trials. And is that really the best way? How is that really done? And is it applicable in our field of massage therapy?
So yes, if we're trying to manipulate something to answer a question that we haven't answered. And so I truly think what happens, I have a database of about 2,000 massage research citations, and it's not beautifully managed at the moment. But what's really interesting in looking at the names on those lists is that we've had potential massage researchers jumping in and out of the pool for years. And if you think about how a researcher becomes a researcher, you get your PhD, and then you get a job at an academic institution, and you have to publish something really quickly. So your first paper is a lit review. Your second paper is a feasibility study. Can I do this? The next paper is the pilot study. And then the next paper is hopefully getting more funding. And so you have this track record, and by the time a person goes through all of that, but the academic researchers are not, space is not, it's not a given at an institution. And then you have, of course, who's the massage therapist. So I do have an article on massage research teams that I've written for Massage Today, just for people to look at this and think, how funding drives massage research. But I think we have all these little pilot studies that don't really answer key questions. And I've done some of them myself just to say, can I set this up? How do we put all the pieces in place? And so if we have questions that we really need to answer, that's the way to answer them. But I think we have a lot more questions about what we're doing and how it differs, right? I don't know many massage therapists say, is massage going to work for this client or not? Yeah. Maybe I'm not going to massage them today, right? We're making other kinds of decisions.
Yes.
And that's not bioinformatics, biomedical informatics is going to drive that. And other healthcare systems are being formed specifically to look at that. And I think we have the potential to do that on, not in local networks. I know there's the Massage Network in Northern Ohio, is a fully functioning PBRN, but they're not connected to researchers, that can enable them easily to mine what they're doing, but they've got a great model, and we could set those up around the country or connect school clinics.
Yes. And, one of the things that I hear when I think about translational research, and some of the things that you mentioned earlier, Virginia, is, I've been a practicing massage therapist for over 40 years. And, in the clinic, right, it's not about, should I see this person or not today, generally. It's about how long, how often, this versus that, those kinds of approaches. And I think having guidelines along the way, it's important to do that. And one of the things that I've heard from therapists is, maybe just a little fear about guidelines being edicts that this is what you have to do, instead of just setting out a framework, of which you can, of course, vary for individual clients, but at least it gives you some idea of a framework, not here's what you have to do. And I think that would be enormously valuable for those of us who are clinicians.
And it's so interesting because there is a guideline out there that everybody's dancing around and nobody's talking about. And that's the membership model at the franchises. So if you think about it, their carrot to get people massages is once a month for 50 minutes. And that's wellness massage. And that's become the standard across the industry. And it wasn't driven by us. It was driven by the business model.
Oh, that's interesting.
Yeah, right.
And so, these are the things that I ponder on the dog walk and go, oh my gosh, is anybody thinking about this? But it's really important to then look at that and say, okay, if that's the industry standard, can we then look more deeply into how and when other clients are receiving massage? Right. And what's happening in those sessions? Because I think we're all doing more common things than we would like to think that we're doing, and maybe even for different conditions. So a real pedestrian example is for a client with back pain. Do you assess for passive insufficiency of the hamstrings by taking them through range of motion? And if you do that, then how is it that you work with them? And something like that would be really important to figure out if we're stretching or we're not stretching clients. And that then could create a guideline under what circumstances you would stretch them. So it's real basic stuff that I think it's in our brains, but we haven't formalized it in our research agenda. But instead, I do think, and I have to, the foundation's done a great job of funding studies, but I think we've been setting people up over the years. And so the question is, at what point does any of that come back to us to reinforce what we do. And yet it's unsexy to try and sell bioinformatics, but
sure.
I think that's where we have to look.
That's a great point. One of the things I always tease students is, do you know why most massage therapy sessions are 1 hour in length? Everybody looks at each other and says, no. And it's like, exactly. Right? Exactly, right?
That's when the clock, it's easier to see, oh, time is up.
But is that actually the best? Does that serve the person? No, it's, so again, what do we do? Why do we do this? We should ask some of those questions and explore it. What is actually best instead of what is most common?
I think laundry.
Just because it's the business model, to come in once a month for an hour isn't necessarily the most effective way. Right. I mean, this might not be the best thing for the clients. This might just be the best thing for the almighty dollar, or this is what people can afford. So it is curious to think about, practice guidelines versus a business model guideline, and are there differences? And one thing that I do want to go back to, though, Virginia, is, you're talking about how there's so much data out there that, even massage therapists have collected for themselves. When people who are out there in practice are using electronic healthcare records, they can kind of pull the data together and take a look at, what is their model. If somebody comes in with this ICD-9 code, the back pain, let's say, and, they're kind of getting treated with massage care, if the sky's the limit, what would that treatment path look like versus what do they actually come for versus what do insurance companies pay for? And all of these things kind of factor in. And, when we look at these issues, we really have to consider, is an IRB needed? And so I just want to caution massage therapists out there that you really have to get a researcher involved, at least to talk to them about what can you ethically look at and publish versus what might you need to take through an IRB or an ethics board.
Well, and that's actually a really good point, because if you're looking at it for your own practice on a micro level to figure out what's best for your client, that's one thing. If you then have a pool of data that you want to aggregate and connect with people, then it's a retrospective exempt protocol. And so there's a way to design research. This is done in education all the time. Education isn't prospectively designed. Students learn something and then you go back and analyze it and say, how did that happen? And so writing a research protocol is not hard, but it does need to connect researchers with practitioners and more than just one practitioner. And so whether it's electronic records or paper and pencil records, some kind of organization is needed so that you can kind of ask the network a question. And that can also then go back to the translational research, which is where we started, to say there was a study, and I don't have the citation off the top of my head, but someone was doing a study, it might have been on mechanical neck pain, where they compared like 3 90-minute studies or massages once a week compared to less frequently, and whatever was preferred by the patients was just not affordable by anybody. And I think it was like 3 90-minute massages a week. Right. So, it's like that. I don't know how much cheaper we can be, but remembering that when you're massaging, it's you and a client. You can't substitute for yourself. So, I think looking at the cost is something else to think about.
Yeah. And I think that's the value, again, this translational idea is, okay, but putting that into practice, how feasible is this? What are the things that we should be looking at? I think there's so many ways that I think the profession would find this incredibly valuable. And again, as directed towards what? For instance, in that once a month thing and a wellness thing, that might be a reasonable thing. We don't know. But I'm not sure that you can apply those criteria to somebody who comes in with very specific, back pain. It would be like saying, does an antibiotic help you if you have an infection? Yes. If you take it once a month, is the answer still yes? I don't think so, right? It kind of matters. It's directed towards what and for what end and what purpose. All those things matter. And boy, doesn't it seem like there's a ton of work to do in the future. We have so much to learn and so much to explore.
But it's good, I think, to start to think about just this separation of, wellness, preventive massage, general stress reduction. That's harder to capture unless you're assessing clients for stress. So I have a small private practice, and I've got my functional outcomes, that's my passion, but also other assessments that I use for my clients. And one of them I ask is, how happy are you today? If massage makes people happy on a scale of 0 to 10, we should see that go up if they get regular massage, right? And so, just in including those metrics, I think is important, but also recognition that when we are treating somebody who has pain or who has a symptom, there's a protocol that we follow, there's a protocol that we recommend, and those are things that are testable, because we could average that out to say, short massages for back pain, 2 20-minute or 3 20-minute sessions for a month, reassess, and then see what happens, and then add self-care on top of that. It really is a regression analysis, and in trying to look at where there are similarities and where there are differences. And again, that can all be done with data. It's nice to get to talk to people about data, because we think about, I'm a massage therapist, who cares about the numbers? But if we were able to come to massage therapists with a recommendation, on average, here's what's happening. On average, here's what the outcomes are for the clients. This is what you can anticipate. That gives us a lot more power as a profession.
Yes. And also, both of you are amazing researchers, but again, as a clinician, I would say that one of the most valuable things about this conversation is that if I, as a clinician, listen to you and talk about how you would discriminate those things as a researcher, I think it's some way in the little r, I do that same thing in the clinic room, right? And I start thinking like a researcher. And maybe the first aspect of that is to start questioning myself. Why am I doing this? What do I expect the outcome to be? If the outcome isn't what I expected, maybe my model of understanding is incorrect. And I think just maybe the biggest value of all of this in one way is to start thinking like a researcher and start questioning things and start thinking, are there ways that I can measure this in ways that might be surprising? And that would help me be a better practitioner. And I think the client would also find it quite interesting as well.
And it really gets into this idea of listening to the client and let them tell you when they need to come back. Right. So, and so it's interesting, because I just, I launched a course platform to teach health coaching, but it's really part of health coaching to say, we're educating clients about massage. They know how it benefits themselves. So yes. if they say to you, I'm coming in with this symptom or whatever the symptom is, and then they start to realize what the cycle is, right? So the product life cycle for massage, right? They can drive us a little bit more. And I do think on a micro level, every massage therapist does this. But, I'm kind of addicted to some of these social media groups, and people are talking about, how do you tell clients when to come back? And that question comes up all the time. And it's like, we should let them tell us, because that's measuring the effects of massage on whatever the outcome it is.
Right. So for instance, if someone has, let's say, restricted forward flexion, and they now notice that they can reach up into that third shelf and get the coffee cup they were doing, right? It would seem to me that if you help them and they have increased range of motion, you don't want your next session to be when they lose it, right? Because you're now back to 0 again, which would be kind of like exercising every 2 weeks. I can tell you how that's going to go, right? Not well, and you're going to be sore every time. But it would seem to me that you'd want to catch that at the point when it starts, when you start losing the benefits, and that's the time. And guess what? In some ways, only the client can tell you that, but that also means that they're engaged in the process. And everything we understand about healthcare is engaging the person in the process is probably a really good thing.
Right. People aren't necessarily on your massage table because someone told them they had to be there, right? So they elect to come see us. We're way ahead of the game of other healthcare providers. But just that idea of that tapering off that you're talking about and connecting to a functional outcome. So if it's reaching up at the top shelf, then that's their own customizable scale to say, when did you first notice that you weren't able to do that? And I think, it's so key working with clients who have chronic pain or clients who have a soft tissue injury where the typical healing is 8 to 12 weeks, and saying, okay, so where's the 8 to 12 week mark? Okay, we're talking about, by St. Patty's Day or by, some holiday, so that they'll forget about the pain and they'll have a benchmark. So, I mean, there are a lot of different ways to do this. And I think sometimes talking about this in the abstract, it's hard for massage therapists to understand. But if we can start a dialogue around real key conditions that we all see and dig into that, it would be very interesting to see what emerges.
Wonderful.
I totally agree. And I think that, there are some research articles out there that do try and help answer the questions, just to give us a little bit of guidelines as to how long might this take to treat in order to, get this much improvement. But really hearing the stories, hearing the data from massage therapists that are out there in the field would be very valuable.
This discussion is so rich, and on behalf of everybody in the profession as practitioners, I want to thank both of you for the amazing work that both of you have done to contribute to the literature in this field. And there's a lot to do, and I think we can do amazing things if we work together and also work with other disciplines, and everyone will benefit in this process. So thank you so much for taking the time to explore this topic. I think it's rich, and there's more to come in the future. So. And
Glad
thank
to
you.
be a part of the discussion. Thanks.
Yeah,
all right.
Thank you.
I hope you enjoyed this podcast, and please consider donating to the Massage Therapy Foundation so we can continue to bring you resources like this and many others to help you deepen your understanding and practice of massage therapy. Thank you very much.